Thank you, Dr. Mendelson. We appreciate having the opportunity to speak with you a little bit from our perspective. We rely heavily on people like Dr. Mendelson, Dr. Dreyer, others to help us understand all of this because it is a learning process for us as well as yourselves. So we appreciate the fact that this is a pretty complex situation. The first thing that we tend to start out with is to really understand what are we trying to accomplish here. And from our perspective, two key things that come to mind from a customer's perspective, from your perspective, is really to appreciate your process that you're going to have to go through from a management of the certification. So we're trying to be appreciative of the fact that if we're going to have certifiable products, that we need to help you make sure that it is managed in a timely way and you can achieve certification without a lot of effort. Additionally, the other thing that we're trying to balance is that you're not trying to put things in place that destroy the operational efficiency that you have come to get from the systems that you have. So these are the two things that we try to keep in mind. With that, from our perspective, we certainly are not trying to be something that we aren't. We are really core radiology-centric systems. We are not trying to be an EMR as an example. However, we do understand what things are relevant in our systems that we need to be able to provide to help with the certification process. So from our perspective, we are creating it from the base foundation of products that we have today. We are leveraging the flexibility and approach that we've had with our products. So as an example, we have always been very focused on standards and structure of fields that we have so that you're not having to do data conversion or massive configuration changes. In addition, we try to base our systems fairly modular so you can pick and choose what you want, even if it's just to be able to get things from a central archive to feed to other systems. Again, we will really follow the same structure. Then we're going to, particularly, our company has decided that we're going to certify, as Dr. Mendelson mentioned, we're certifying ourselves as an EMR module. We keep the functionality really tailored towards what's radiology-centric, and we're not really, again, trying to create a RIS of being something other than what a RIS is really meant to be. So then from your particular decision, which I think is what Dr. Mendelson alluded to, you really have to decide, are you going to have a certified EMR and have the EMR submit all of the information, or are you going to have a group of certifiable systems that can combine to do all of that? We try to help support both of those. So if you choose to have your EMR be the certified system, we of course can feed that, and we feed that in a very structured format. We know what we have to feed. There are very specific nuances in the way you have to collect information that you might not completely be aware of. So demographic information is not categorized like you might think it is sometimes, and so we are very literate on what those standards are, and we will apply to those. So we can obviously submit our MU information directly if you want to use this as a modular piece of the certification, or we can certainly send it to the EMR without any data conversion. As you'll see, though, the way we are going through this, we do have an aggressive certification strategy, and based on the way we're approaching it, and if you apply for some of the exclusions that Dr. Mendelson mentioned, you can actually achieve full certification with our product. So I'll talk a little bit about that. But we're going to be certified. We're going through the organization called CCHIT, C-C-H-I-T. That's where our certification will be coming through. We are doing it in two phases because we do have some work on the product that we are going to need to do. But this gives you a feel for, in the initial phase, which will be done in the fall of this year, how you can actually get a number of those core measures and then menu criteria and then CQM measures from the system. And then in the second phase, we'll actually have in the spring of next year a total certification that will have all the core measures except those 3 or 4 that actually, if you are, for example, an imaging center, you can have exclusion from, and so that's how we are able to actually be able to, for imaging centers, allow you to use the product and get full certification without any EMR. So that is a process that we would be able to support. And then obviously for hospitals, we assume that you're going to probably have other systems that are going to be certified. You will potentially have EMR and others, and we will be compatible again through the way we structure our standards and our configurations of our products. So that's a little bit on the approach that we're taking, and with that I think I'm turning it over to Murray.